This woman has all the signs and symptoms of pregnancy. She feels all the signs you can talk about of pregnancy, but whenever she goes to the hospital, the doctors tell her that she's not pregnant. She even does her own pregnancy tests, they come out to be negative. What is the problem here? And how many times should a woman sleep with her husband on the ovulation day in order to conceive or in order to get pregnant? All that in this very particular video of Ask Dr. Uthman. Don't go away.
Ask Dr. Uthman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthman YouTube channel, a channel where I learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me, to have a private chat with me, go to my website www.druthman.com and book an appointment. We shall have a chat privately. And if it's your very first time to watch this video, please don't forget to subscribe and also press the notification button in order to be notified of any video we upload. Today we have very interesting questions from our friends, and let's start with question number 1.
Hi doctor, my name is Cindy from South Africa, and I really want to know what to do because I've been struggling to get pregnant for the past 3 years now. I've been struggling to get pregnant. I go to my periods each and every month for 5 days. I will go to my doctor's every second week of my period because that was the instruction she gave me, and she will run the test and she will see nothing wrong. She will just tell me that everything is fine. She will do the scans and everything. She will see that everything is fine. So I don't really know, or I'm just missing my ovulation date. I don't know. Please help.
It's quite frustrating, and I guess it can frustrate anyone if such thing happens to you. But let's first understand a few things here. She is not getting pregnant despite going to her periods, and she says that she goes to her doctor, they do tests, and they are saying she's fine. 3 years down the road, she's not conceiving. My friends, let's first understand infertility. I have taught infertility several times here, but I think we are not getting the gist. Let's understand this. For someone to be called infertile, or for us to say that you are infertile, that you have failed to conceive, we must satisfy 3 conditions. Number 1, you must be having intercourse at least 3 times in a week for a period of 1 year. So, is our friend satisfying this? Is only satisfying 1, which is 3 years. I don't know if this colleague of ours is having intercourse at least 3 times in a week. So, this is very, very important because you find women out there crying, saying, I am not conceiving, but when they are not satisfying these conditions. You must be having intercourse at least 3 times in a week for a period of a year to say that, hey, there is something wrong with me. And again, this intercourse should be unprotected. I'm telling you, I received a case. It's very interesting. Someone came, told me she's not conceiving, but they were using CDs. It's very interesting. It's very interesting. So we must satisfy these conditions. Intercourse at least 3 times in a week for a period of a year. Then, another thing, you should not be using any contraception. Like I've said, not using CDs, not using any family planning method. And it should take a period of a year. Now, having periods, even if they are regular, doesn't mean that you are fertile. Because there are several other causes of infertility. And again, you cannot tell me that I have failed to conceive for a period of 3 years and I have done all the tests and they are normal. I will doubt that. There is something wrong. You cannot fail to conceive and we say that everything is okay, you're just failing to conceive. No, there must be something wrong that we have not yet found out. Either you've not done all the tests. Because at times, people go to the hospitals and only do a scan. The pelvic ultrasound scan or abdominal ultrasound scan will tell you, yeah, everything is normal. The liver, the kidney, the bladder, the uterus, they are fine. And then you say, you see, I have done the test and it's saying everything is normal. Then why am I not conceiving? My friend, that is not the only test. There are several other tests you can do. Have you done an HSG X-ray to find the patterns of your tubes? Have you done a fertility hormonal assay to check on your hormones? Have you checked the follicle-stimulating hormone, luteinizing hormone, AMH, estrogen, progesterone, prolactin? Have you checked for diabetes? Have you done all these tests to really confirm that everything is fine? I guess no. You might have done some tests, but you've not exhaustively done all the tests. Therefore, my advice to you and everyone who is facing such a challenge is to go and carry out all the fertility tests in order to confirm that the problem is not. And actually, by the way, you may find that your husband has a problem. So, has your husband done a sperm analysis? Have you done the male fertility tests? Have you done the androgen tests to find out whether your man is okay? So, this is what you need to look at in order to find the solution to your problem. Let's have another question.
Good morning, sir. My name is Confidence. Please, I want to lay a complaint about how after my ovulation, after having unprotected sex with my husband, I started feeling pains in my stomach, followed by tenderness of the breast and some other symptoms like feeling sleepy, tiredness. My temperature was, a bit high in the morning. But when the time of my period came, it didn't come that exact day that it's supposed to come. The next day, I started seeing my period. So I don't know what could be the cause, sir. Thank you, sir.
To be sure, these questions are quite many about people having pregnant symptoms, but they are not pregnant. Now, my friend, this is what we call anxiety. And if you go to a psychiatrist, they will tell you, or a psychologist, they will tell you that that is anxiety. Why? It's because you are in a condition, you are in a situation where you badly need to conceive. You are in a condition where you are frustrated. What you want to hear is that you are pregnant. Now, because you are in that condition, you are so desperate. The moment you look at your phone, because some of you have those ovulation apps, when you look at your phone and it's the ovulation day, and you've had intercourse with your husband, I am telling you, within 24 hours, you will develop signs of pregnancy. The tenderness of the breast she's talking about, you'll have morning sickness, you will vomit in the morning, you feel sleepy, you'll have low abdominal pain, you'll have all the signs of pregnancy. It's because of the anxiety. It's because you're anxiously waiting to be pregnant. That's why some women say, I can't wait. So it's because of anxiety that you're receiving these signs, but you're not pregnant. And therefore what I advise here is to find out why you are not conceiving. Because it's just clear that you really want to conceive, but you are failing to conceive, and that's why you are anxious. Whatever comes to your body, what you overfill yourself, and you think you are pregnant, yet you are not. Therefore, go and do tests to find out why you are not conceiving. Those are not signs of pregnancy. We call them anxiety signs or pseudo signs of pregnancy. Let's have another question.
Doctor, good day, sir. My question is, I want to know how many days or how many times should I have sex with an unprotected intercourse, sexual intercourse, during my fertile period for me to conceive? If I want to conceive, how many times can I have sex in that fertile period for me to conceive?
Yes, how many times should someone sleep with a spouse in order to conceive on their ovulation day? How many times, how many rounds should someone have? I don't know. This is really also very interesting. Now, what I want you, whoever is watching this video, I want you to comment and tell me, especially those in long distance relationships, I want you to comment and tell me how many rounds you had with your partner in order for you to conceive during that ovulation day. Please tell me down in the comments. But now, what I would like to tell you is that the number of times doesn't matter. It is not all about the rounds you've had. It is not all about how many times you've had intercourse with your husband in order for you to conceive. Even one time, just a single round is enough, even if it's not complete, as long as your man has released. So, as long as you are fine, your eggs are fine, your uterus is okay, everything is okay, you're on your ovulation day, man, you only need once. You don't need many times. Once is enough. Okay, of course, the higher the number of times, the higher the chances, because the chances increase. Because you know, the more substances you deposit there, of course, they will have a higher chance of fertilizing the egg. Therefore, yes, it is true that the more times you have it, the higher the chances, of course, the chances will increase of impregnating or getting pregnant. However, even one time is just enough. If you'd like to get in touch with me, to have a private chat with me, please go to my website, www.druthman.com, and make an appointment. If it's your very first time to watch this video, please don't forget to subscribe and also press the notification button in order to be notified of the next videos. And you can find us on all our social media platforms. The name is Ask Dr. Uthman. And for you as watch this video, I want you to comment down and tell me the number of rounds you had in order for you to conceive. I sign out.
Ask Dr. Uthman on Sawa